What is acid reflux? Acid reflux is a common condition that features a burning pain, known as heartburn, in the lower chest area. It happens when stomach acid flows back up into the food pipe. Gastroesophageal reflux disease (GERD) is diagnosed when acid reflux occurs more than twice a week. Chronic heartburn can lead to serious complications. Symptoms of acid reflux. Acid reflux usually produces heartburn, whether it is due to a single episode of overeating or persistent GERD. Heartburn is an uncomfortable burning sensation that occurs in the esophagus and is felt behind the breastbone area. It tends to get worse when lying down or bending over. It can last for several hours and often worsens after eating food. The pain of heartburn may move up toward the neck and throat. Stomach fluid can reach the back of the throat in some cases, producing a bitter or sour taste. If heartburn occurs 2 or more times a week, it is known as GERD for short. Other symptoms of GERD include dry, persistent cough, wheezing, asthma and recurrent pneumonia, nausea, vomiting, throat problems, such as soreness, hoarseness, or laryngitis, voice box inflammation, difficulty or pain when swallowing, chest or upper abdominal pain, dental erosion, bad breath. What causes acid reflux? Acid reflux is when some of the acid content of the stomach flows up into the esophagus, into the gullet, which moves food down from the mouth. Despite the name, heartburn has nothing to do with the heart. The stomach contains hydrochloric acid, a strong acid that helps break down food and protect against pathogens such as bacteria. The lining of the stomach is specially adapted to protect it from the powerful acid, but the esophagus is not protected. A ring of muscle, the gastroesophageal sphincter, normally acts as a valve that lets food into the stomach but not back up into the esophagus. When this valve fails, and stomach contents are regurgitated into the esophagus, the symptoms of acid reflux are felt, such as heartburn. Risk factors. GERD affects people of all ages, sometimes for unknown reasons. Often, it is due to a lifestyle factor, but it can also be due to causes that cannot always be prevented. One cause that is not preventable is a hiatal or hiatus hernia. A hole in the diaphragm allows the upper part of the stomach to enter the chest cavity, sometimes leading to GERD. Other risk factors are more easily controlled: obesity, smoking, active or passive, low levels of physical exercise, medications, including drugs for asthma, calcium channel blockers, antihistamines, painkillers, sedatives, and antidepressants. Pregnancy can also cause acid reflux due to extra pressure being placed on the internal organs. Food and dietary habits that have been linked to acid reflux include caffeine, alcohol, a high intake of table salt, a diet low in dietary fiber, eating large meals, lying down within 2 to 3 hours of eating a meal, consuming chocolate, carbonated drinks, and acidic juices. Risks and complications. Without treatment, GERD can lead to serious complications in the long term, including an increased risk of cancer. Persistent exposure to stomach acid can damage the esophagus, leading to esophagitis. The lining of the esophagus is inflamed, causing irritation, bleeding, and ulceration in some cases. Strictures. Damage caused by stomach acid leads to scar development and difficulties swallowing, with food getting stuck as it travels down the esophagus. Barrett's esophagus. A serious complication where repeated exposure to stomach acid causes changes in the cells and tissues lining the esophagus with potential to develop into cancer cells. Both esophagitis and Barrett's esophagus are associated with a higher risk of cancer. Thanks for listening.